Guys, welcome back to BlockHash Con. Thanks for joining us after the break here. We got a great slate of speakers here to start the second half of day one. Pradeep, the CEO for Solve.Care, is joining us for the first talk of the afternoon to talk about Web3, blockchain, healthcare sector, and I believe he has some specific topics in mind in regards to Solve.Care. So Pradeep, welcome and thank you for taking the time to show up today and present on what you guys are doing.
Very well. Thank you, Brandon. And thank you for having me here. It's a pleasure, and looking forward to speaking to all of you in the audience and sharing some insights. So again, thanks for the opportunity.
Yeah, likewise, of course. I'll give it to you to take away. I know you have a presentation to pull up. Lolo and I will be here on the sideline in case you need us. But the stage is yours.
Great. And I presume you can see it properly, yes?
Yes.
100%.
All right. So hello, everyone. My name is Pradeep Goel. I'm the CEO of Solve.Care. I've been in healthcare for 30 plus years, and that's an accurate number, actually 33 years and counting. And I got involved with building a healthcare platform using blockchain and Web3, but in 2017, so 6.5 years. And a lot has been learned over the years that I would love to share with you all today, practical use cases and real problems. So today we are going to discuss what's the real value of Web3, and is there any ability to solve real world problems? Because technology for the sake of technology does not drive value for society or create economic value. And really the answer to any technology, cloud or mobile or Web3 or AI, is in its application for the end user. And that's when we see human value, we see societal value, we see economic value, we see enterprise value, and most importantly, we see value in what we are doing as professionals. So let's get into that here. So first of all, a bit of an introduction. I've been blessed to understand healthcare from many different angles. I've been part of the commercial insurance space. I've been part of the government program space. Of course, I'm a parent and a child of parents, and they all need healthcare. My mom, my kids. So I'm a pretty meaningful consumer of healthcare. My family, like most others. And I've had the opportunity to work on public health initiatives that have impacted the lives of literally tens of millions of people, and learn from that experience what really matters. I'm an entrepreneur at heart. I've started many healthcare IT companies. This is my fifth venture and the most promising and the most challenging. The journey so far has been extraordinary. And I'm happy to share my views on how Web3 and blockchain and decentralized ID and zero knowledge is actually going to impact humanity for the better, and what's the pathway to achieving that end goal. So let's start with the problem statement. Let's say that you get a call on a Thursday afternoon from your mom that she's not feeling well, and you don't live in the same city. Right there is a beginning of a nightmare, right? You have to now think about, I need to find a doctor, I need to talk to her insurance company, I need to make an appointment, manage her appointment, make sure she gets to the appointment, I need to make sure that she gets her prescription filled, I need to make sure that if there's any home care needed, we have that set up. I need to understand how much money this whole trip to the doctor and prescription will cost so I can help her pay for it, and then I need to make sure she does the follow-up. Normal scenario, a standard healthcare episode, as the industry calls it, but it's not just an episode, it's a life-changing event, and it can really throw you off your game. And to do all that requires an enormous amount of coordination between you, your mom, the doctor, the insurance company, the pharmacy, the lab, the specialty care provider, the bill, the payment. It's a very meaningful event. And nothing that exists out there makes this process easy. In fact, the current technology stack in healthcare is designed to make this as difficult as possible. And the reason for that is simple, because you have all these disparate systems built and run by different institutions and stakeholders, and they don't talk to each other, and they don't want to talk to each other because they have conflicting interests, business interests. And it's your job to be that hub between all these people. It's your job to get A to talk to B, B to talk to C, and move data between them using your hands and arms and your car, because they don't communicate effectively. And if they do communicate effectively, they leave you out of it. So either way, it's a pretty difficult situation. We believe that this represents an unacceptable state of affairs, and the job of technology is to change that. The job of technology is to put you, the consumer, in the center of all these stakeholders, and where this whole team works around you to deliver better care. And the solution statement is that we really need to break down three types of silos. We need to break down the silos of care, which determine where I can go get care from. For mom, we need to break down silos of data, where who has what data, and getting them all to talk to each other. I should be able to break all these silos open. And third is silos of payment. I should be able to pick the provider I want, work with them and pay them, and then get reimbursed, instead of having the payment organization like insurance or Medicare or Medicaid deciding for me who I can go get care from. So we need to rethink healthcare from a human-centric perspective, not even patient-centric, but human-centric. And the way we'll achieve that is like every other industry, which is to create a network which offers me services that I can join and buy services from, and the ability for me to choose the right network for the right time of my life at the right price point. So we envision a world where different healthcare stakeholders, be it hospital or pharmacy or lab or insurance company or employer or government agency, to publish a network on an open global fabric, inviting people and offering services to everyone, be it a parent or a patient or a child or employee or citizen, no matter what your role is, to join the right network and to access the care they want and to choose between these networks. So think of it as a fabric which connects to everyone, but you can buy the right set of services from the right provider, kind of like an Amazon of healthcare, but you get to choose what you are buying from whom, and everybody on the network has a certified role and identity. So you cannot be subjected to fraud. And to achieve that, we have built a platform. And that platform lets you create your own network or participate in other people's network. And the notion of this platform is that two participants on the platform can exchange cards, which carry information, data, records, images, videos, identity, bill, payment. And using those two wallet interaction on the platform, you can interact with each other, you can exchange cards, and you can pay each other using the native currency of the platform. And in doing so, when party A, like a patient, talks to the doctor needs to talk to the insurance company needs to talk to the patient, they can all interact with each other in a truly open, secure manner. But the communication between those two parties is totally secure, meaning what patient is telling the provider and what the provider is telling the patient is secure between them. But then the provider can share the right information with the insurance company can send the right bill to the patient, and everybody, not just A, B, and C here, three parties, but infinite number of parties can collaborate. So you could expand this network to include patient, doctor, payer, pharmacy, lab, family member, specialty care provider, government agency, employer. Whoever needs to participate in the network can be authorized to join the network. And everything is controlled in this network with this thing called care protocol, which governs the behavior. And the protocol is on the chain, which means that nothing can be done that is not public. The entire behavior of the network is in the protocol, and the protocol is on the blockchain, which makes it impossible for A to cheat B or B to do something wrong with C, because they can only do what the protocol permits. So this is the core premise of redefining healthcare worldwide. Now, how do I access this network? Everybody has their own wallet, and that wallet gives them access to the right network and at the right time. So your wallet is your personal access point to any and all networks on the platform. It's kind of like a browser. You can browse any website you like. The website in this case is a care network. And from that browser, you can share identity, you can send and receive records, you can request and make appointments through the wallet, you can book a ride to get to the doctor's office, you can refer a bill to your family members to help you pay for it. You can invite your family members to look at the doctor's notes, to provide you support. You can do anything and everything you want to do to manage your healthcare by joining the right network and creating your own private network called Care Circle, where you can collaborate with your loved ones. So this is the notion, and it works really well because underneath the wallet is a Web3 container where each wallet has its own private information, and they can share information between wallets by achieving the exchange of cards. So all parties have a set of cards which they can use based on their role, and those cards move between wallets. But when they move between wallets, the transaction gets written to the blockchain. The events are recorded in the event ledger. The data is off-chain but linked, hashed to the chain, and the identity is not shared with each other unless you decide to. So you have zero knowledge trust between wallets, but you don't have to know each other's identity to interact. In most cases, you will share identity, of course, but you don't have to in scenarios where it doesn't make sense. So this elegant solution allows us and people like me who have been building complex healthcare solutions to reimagine how healthcare should work. And the way you should think about healthcare working is really like playing with a deck of cards. And these deck of cards can be authored very quickly in the care labs. But by creating a deck of cards that move between wallets that are automatically linked to the chain, that each card is an immutable event on the event ledger, and the content of the card is written to a vault, which is stored in a Web3 container, which you have 100% control over. We have married the immutability of blockchain with zero knowledge trust capability of anonymous interaction with the ability to use decentralized storage to create a fully secure, personalized Web3 container. All these three things come together to create a whole new paradigm, okay? And this is how it looks like in the sense of designing new healthcare. You design cards, you link them, and you allow different wallets to exchange them, and you can automate everything. And our vision is that all the existing systems, electronic medical record systems like Epic, Cerner, McKesson, Athena, Allscripts, which are big names in the US and worldwide, or the centralized workflow systems like Salesforce or ERP, SAP, these solutions are all fundamentally flawed in that they give control to a single party, and where there is this hierarchy of superpower and then the minions who use their system and are given access. So you have this very inappropriate hierarchy where a party who controls all the data and all the logic gives us at their benevolence access to their platform, and we get to use it. And in doing so, we trade off our security, our privacy, our data, our ability, our choices, because we are being given the privilege of using somebody's system. Now we are bound to the rules of their system. In our world, everybody's equal. The cards are publicly, the logic of the cards is in the protocol, which is on the chain. So you don't need to join a network whose logic you don't like. You don't need to accept or execute a card on your wallet that you don't accept the rules of. And if you're not sure about a network behavior, you can have a third party review the protocol and say, no, this is pretty good. Nope, this is pretty bad. So this allows for the logic of all the systems that are currently secret to become public. And that, I think, is really important, because as a consumer, I don't know what happens to my data when I give it to my hospital or to my doctor or to my pharmacy. It sits in their systems and it goes into this dark hole, and what they're doing with it, who they're sharing it with, how they're massaging it is all secret. We don't know anything about it. So you have to do this blind trust. And blind trust leads to abuse of power, to a sense of disenfranchisement, and leads to patient not feeling and actually not being in control at all. So by putting the logic on the chain and by hiding the data, we protect the privacy, but we expose the intent. And by exposing the intent, the ability for one party to screw the other literally goes away. Okay? So the process of building a very powerful network is actually quite simple. You sign into the care labs, you author a card, you can design its user experience, make it look as beautiful as you want. You can deploy it through the labs, and it will appear in your care wallet within minutes. So the whole idea of transforming healthcare begins with letting the consumer, the physician, the nurse, the pharmacist, the Uber driver, the family member, everybody to be able to author cards and use cards in a way that allows them to manage their healthcare. And then, of course, as an institution, you should author a full deck of cards that allows your patients or your members or your doctors or your pharmacists to collaborate and manage. So as an institutional entity, stakeholder, like a hospital or a pharmacy or a lab or a insurance company or benefit broker, you can build your complete network. But as an individual, you should also build cards that help you run your healthcare better. So the way it works is that you go into a product called Care Labs. You can go into that. It's a pretty simple, designed to be physician-friendly tool where you can come in and create the network. You can design who will participate in it. All the participants will appear. You design what kind of cards you want the participant to be able to send, let's say, from a patient to a doctor. And for the most part, you can leverage existing cards if you like, but here we are showing you how easy it is to build a new card that would be really, really complex in the current healthcare world with EMRs and eligibility and enrollment and member management systems. All the work that you would normally spend literally hundreds of thousands of dollars doing, you could do in the Care Wallet, in the Care Labs within hours. Let me put things in perspective. When I was in my previous role as CIO at insurance company or as working on large projects on Medicare or Medicaid or Obamacare, the bill for most of these implementations ran from between 5 million to 500 million. And that's not an exaggeration. It was not uncommon to say, oh, we got to build a new eligibility system for a state. Starting bid is 150 million. By the time you implement all the change orders, you're going to spend $500 million. If Solve.Care platform existed 6 years ago when I was implementing these gigantic systems, we would be spending days and weeks to do what it took us years to do. The budget would be not 150 million or 75 million, it would be 750,000 or less. And the time to market would not be years, but days. Why? Because all these healthcare systems require you to start from scratch. You got to look at the infrastructure, the data model, the operating system, the mobile app, the web browser, the ESB or the REST API services, API gateways. 80%, 90% of the money gets spent on just building the infrastructure and the plumbing. By the time you get to building the bathroom where somebody can actually take a shower, you're already out of money. You're run out of energy and time and money because you put all the money in the foundation, in the basement, and in the pipes in the wall. Our job as a platform is to get rid of all that investment and say, just imagine the bathroom. Don't worry about all the plumbing. It's all taken care of for you. Don't worry about security and audit, and don't worry about building a mobile app or building a web app. You just define the cards. And if you define the cards that you need to deal with your patient or your family member or your doctor, and those cards are ready to use, you just deploy them, and the whole infrastructure is in place for you to start using those cards inside the Care Wallet and start exchanging information and start connecting with the other party. So the notion of this is that using a pre-built open fabric, which nobody controls, not even Solve.Care, but is secured by technology and by cryptography, you can build anything. You can build an appointment system, an admission management system, an authorization referral system, a care coordination system, a case management system, a billing and claims management system. In healthcare, there are lots of transactions, but in the end, there are only so many transactions. No matter how complex a healthcare system is, whether it's US or Canada or Australia or UK or Saudi Arabia or South Korea, in the end, you're going to boil down to about 24 types of transactions. You can build every one of those transactions independently on the Care platform, or you can build them in single network, or you can build them iteratively. But the point is, what is without Care platform a $100 million problem, with the Care platform is $1 million problem. So with that said, we have built a lot of systems, and third parties are starting to build systems on the platform. Here is a healthcare plan selection and enrollment, which replaces their website. So you can allow a consumer to choose which healthcare plan they want to buy, look at all their costs, enter all the data, and essentially enroll in within minutes. This problem, by the way, if those of you who live in America, You might remember that when Obamacare was launched, there was a disastrous launch of the healthcare.gov, and it was a very bad day for America and in general for healthcare. That system took 18 years and hundreds of millions of dollars and blew up on launch. You could build that in about 2 weeks. Provider directory for an insurance company where a patient can quickly find doctors who are near them, who are highly rated, who are accepting visits, who are affordable. Again, the provider directory is a big problem for most insurance companies. They all have provider directory apps, which are very specific to their group of providers. But as a patient, I want to be able to look at providers more holistically. And no insurance company is going to give you that, but you can build a provider directory network on a platform and have providers self-enroll, and you would have a much better solution, as an example. Or you could take your provider directory off the web and do it that way. Billing and payments is another example. Medical transportation is using our built-in Uber capabilities. You could do that. You could build essentially a card system to allow a provider, a doctor, or a patient's family member to link appointment time and the patient's home address to an Uber ride card, which will automatically calculate how much time you need to get from home to the doctor's office, accounting for traffic. And given this is a first appointment, add extra 15 minutes for the paperwork. So grandma needs to leave home at 8:45 for a 10 a.m. appointment and have the car showed up at her doorstep, paid for by granddaughter, and grandma doesn't even need to have Uber on her phone. All kinds of really cool systems and are being built. Now, the idea is that all these networks, as they are being built, can talk to each other. So it's not that you build a network and that's just your network, and I build a network and that's just your network. Each network is automatically interoperable. Cards can move between networks. Identity can move between networks. So as a consumer, I can be part of a network with a pharmacy, but I can also be part of a network with a doctor, and I can send the doctor's prescription from network A to pharmacy B. In that case, I am the hub. I don't need the doctor to talk to the pharmacy. They can send me their prescription card. I'll forward the prescription card to the pharmacy. I don't need the two of them to talk to each other because I'm the real hub. My wallet serves as the actual interoperability hub. Using this model, we expect that every disease condition, every specialty in every geography, connecting to every kind of a therapy will eventually become a network on our fabric, because the alternative is too horrifying. The alternative is more silos, more pain, more money being wasted. And when you look at the total healthcare spend, it's $8 trillion a year and growing. We can reasonably estimate that $2 trillion out of the $8 trillion is not spent on healthcare, but on administering healthcare and on moving paper. So why can't we get rid of that $2 trillion, which soon will be $3 trillion, then it'll be $4 trillion? It's a ridiculous expense for humanity that we cannot afford. So having a global fabric on which network of networks can exist, they're easy to publish, they're easy to use, they're very cost effective to operate. You can allow intra-network and inter-network payments. You can cross-sell opportunities if you need to at least cross-sell services. Everything is auditable, and you can configure compliance by the patient's residency. Creates a completely new paradigm. So whether you're a doctor or a hospital or a pharmaceutical company or an insurance company, a government agency or an integrator or an innovator, there is a role for you here, and we invite you to be part of that. Why this is truly disruptive? Because underneath all this is a healthcare operating system that's based on immutable ledger that uses zero-knowledge exchange of information that allows for secure identity, including third-party identity verification, that has built in its own mobile applications. You don't need to write a single line of mobile app code, and you literally can just publish in your wallet the cards within hours, and in what you would take you years without the platform would get done within literally a day. The patient has a very uniform experience. Patient only plays with cards. The patient doesn't need to understand any technology. No matter which network they join, they're always dealing with the same style of deck of cards. So the paradigm is simple. It's grandmother friendly, which is receive cards, send cards, shuffle cards, sort cards, but you're dealing with a deck of cards. And that paradigm we can explain to the literate and the semi-literate and the illiterate, and the experience is very uniform. So just because you built a network and I built a network, the patient doesn't need to learn anything new, because all networks will operate on the same card principle. As the patient's needs change, they can just join different networks, which means they never have to leave the fabric. whether I'm young and healthy and I don't really care about chronic disease, or I'm old and I am worried about, or I have chronic diseases, the wallet can stay with you throughout your life because it's a network that delivers a service, not the wallet. And it's a cheaper, faster, more flexible solution. We have demonstrated that everything we do is 10% the cost of traditional IT, and it is 10 times faster to go to market with us than it would be with starting with a, some kind of a cloud computing or some kind of a centralized platform, Web2 platform. So it's a way faster way to go to market. And it forgives mistakes. If you build a card, nobody likes it, change it, republish it within a day. If you build a card, people love it, you can build upon it and add a second card to it. And most importantly, you can configure the card to a country or a region or a disease or even a wallet or a profile or an avatar. So you can achieve compliance at the card level, which is a lot easier than trying to achieve compliance at the system level, which is always difficult, if not impossible. So with that said, we have lots of very interesting clients using our platform to do very interesting things. But what's really important is that we are focused on 8 diseases that will affect 4 billion people over the next 20 years. Heart disease, stroke, cancer, diabetes, COPD, neonatal conditions, kidney failure, and dementia will kill majority of humanity over the next 20 years. Right now, these diseases cause 55 million deaths a year, and that number is increasing. And majority of the $8 trillion a year cost is attributed to these 8 diseases. So our focus right now is to build at least 8 care networks, one for each disease, that interacts with every other network to achieve a better access to care. Starting with information networks, then going into to best care practices, and then moving into appointments. But the point is that each of these networks can grow and evolve independently, but each network serves a huge part of human population, all accessible through one care wallet and regardless of age or geography. Now, Andreessen Horowitz, which is a storied venture capital firm out of Silicon Valley, they published a blog recently that the future's biggest opportunity company, if you will, is to build a consumer-obsessed healthcare technology that will reimagine care, what care looks like. We agree with that, not necessarily with their exact approach and how that will happen, but we do believe that the biggest opportunity for humanity lies in innovations like the tech innovations we see, AI and other things, but much bigger than that, much more fundamental to our existence is our ability to get proper healthcare for ourselves, our parents, and our kids. And that's the fabric that will alter both societal and economic and healthcare experience for human beings across the planet. And that's our vision. And we want you to be part of it. Because no matter whether you are a patient or a provider or a physician or a nurse or an insurance company CIO, or you're running a small mom and pop pharmacy somewhere, there is a role for you in using the fabric, in building on this fabric what you can use today with your stakeholders, or leveraging what others have built. Because we have a large community who is building cards and journeys on a platform, and you can leverage them, or you can be part of the community to build your own. So with that said, we invite you to reach out at info@solve.care, or on Twitter, on Facebook, on LinkedIn, on Telegram, and we'll be happy to hear from you and how we can help you achieve a better experience for you, your family, and your community in whatever role, shape, or form you see healthcare working better for all of us. Thank you very much, and I appreciate your time, and I wish you to enjoy the rest of the conference.
Awesome. Thank you, man. That was awesome. Couple of questions on my side in regards to Solve.Care that I think might be kind of interesting. One is, does this open up the ability for people to go direct to a doctor, or do they still have to go through a hospital in some sort in order to use Solve.Care when you're trying to work with a physician of some kind?
So it depends upon the physician. Usually acquisition, appointment, billing, payment system, which they won't be able to do otherwise. It'll be very expensive. And they can still keep serving insurance patients, but they can start accepting non-insurance or direct cash patients. And if you're living in a country where insurance is not a big deal or not that prevalent, then yes, you won't even need to think about that. So the answer to your question is, it's really about choice. There's nothing wrong with an insurance-sponsored network. In fact, they're very valuable. They serve a huge amount of population in the world, but they're not for everyone. But they don't need to be. So in that regard, the answer to your question is absolutely yes. Wherever possible, a direct interaction between patient and doctor can be easily facilitated on the platform through a set of cards, and they can coexist the existing model of in healthcare, which is based on insurance and provider networks. One does not need to go away for the other to work. And you can do both from the same wallet.
Okay, cool. Yeah, I know for so many people, having that optionality is always one of the most biggest things when it comes to healthcare, just being able to choose. Because so often, like in the US, we get locked into a certain provider, like Kaiser Permanente, for example, and then you are kind of stuck within that network in terms of what it'll cover and what your copays will go to, and where you can go to the pharmacy, and what physicians are available for what ailment you have, regardless. And that can be very frustrating, especially in the US. So it's cool to have solutions like this where it seems like it gives people at least more options to explore what's a better fit for them, and give them perks to privacy and control over their data and their files, which I thought it was another interesting question to ask. Is how universal is it to have your own cards in the Care wallet? So like if you have your own patient files and you have access to your health records and your own health data, is it easy to transfer that? Like, let's say you're overseas, you're in a different country, in a completely different healthcare system, being able to work with a hospital or a doctor there and provide them all your information so you can get care, versus having to rely on your hospital back in the States to transfer that information and be available, and to have it be accepted by the hospital, because sometimes that is another huge issue. So in terms of it being more universal, I think the answer is self-evident, but I'm just kind of curious for your opinion.
Yeah, I think there are two ways to look at it. One is transferability of data should be seamless and secure. So any wallet can send a card to any other wallet with just knowing their ID, but you need to have their ID, wallet ID, to send it. You can also send, if the other side does not have a wallet, you can send them a card, but their card will convert to a message telling them to download the wallet, and then they can receive that message and see it. So two parties with wallets can exchange information, like two sides with WhatsApp can exchange information in a secure way. But what you're sending is not a message. You're sending a care card, which can be simple or very powerful or very, very complex, in the sense the card can carry records, it can carry logic, it can carry payment, it can carry identity. So the cards are not just a message. A card is a complex, a very multidimensional message, right? And card has a UI and a UX. So when I get a card from you, there is an actionability to the card. I can touch a button and do something. I can reply to it. I can archive the card. I can forward it on to somebody else if the card allows me to be forwarded, or I cannot forward it if it's not permitted. So this is very powerful custody of data, but it's also very strong interaction. It's kind of like WhatsApp on steroids built for healthcare, right? So you can do any card you want. Now, that's one element. So transferability is instant and secure and immediate. But then there is a second part. What are you transferring? So you can transfer your medical records. You can transfer images or videos of injury, or you can send your prescription data, or you can send your identity proof of identity, which can be verified by a third party. So you can just send your token over to say, look, you don't need to trust me that I'm Pradeep, but when I'm sending your token from a trusted party that says that they have checked my passport and my driver's license, so they've issued me a token that proves that I'm Pradeep. So take the token, you don't need to look at my passport. And if you accept the token, we have established who is who. Or we can have a token proving my credentials as a doctor. Or I can have a token proving my credentials as a broker or an agent or an employer or insurance company, whatever. So the point being that you can carry through this card anything, not just medical record. You can send through the card identity, payment, bill, records. You can share symptoms. You can request an appointment. You can get an appointment confirmation. That's just another type of a card. What the card can do is there's no limit. Its only limit is your imagination and the needs. So then comes the third question, where is the data going to come from? So most patients don't have data themselves, right? Their data is sitting with the doctor, the lab, the pharmacy. So in the ideal world, all of these parties who have your data would simply have a wallet, and they would share that data with you through the wallet. So they'll just send you, instead of sending you a mail or an email or a PDF, they could just send the records through the wallet to you. That way they have proven that there's more safety for them, there's more safety for you. But there's a second part. There are traditional system APIs, what's called meaningful use API, through which you can request your records from a hospital. So those APIs are also built in. So you could actually build a card to request your records from Mayo Clinic or from Johns Hopkins or from government. And under, at least in many countries, the law says when the patient requests it, you must give the data. So we can request that data through the wallet and get the data into the wallet. So you don't have to go hunting for paper and CDs and DVDs and how else they're going to ship the data to you. So there are many things about this, but end of the day, make the transferability secure and peer-to-peer, make the logic of the card super strong to make it more than a dumb message, make it basically an application in a box that moves around like a D app, and then allow the data to be consumed from all the known sources in healthcare. And yeah, you got a fabric.
Interesting. Lolo, did you have any questions?
Yeah, kind of. I love the brilliance of all of this. This has been something that's been talked about in the space for a long time, but to see like you actually have the application ready to implement this is phenomenal. My general question is about that, and that process. What would you say were the biggest challenges to putting all of this together? Because of the scope of what you're doing, while based on first principles, it makes the perfect sense. Getting to where you are right now, you can pave the path. But what did you find were like the biggest hurdles, and how did you overcome them?
Well, it's been a long journey. 7 years to invest in building a platform is a meaningful commitment of time, money, and a big part of your life. So in that regard, I would say it has been a challenge that very few have taken on because it is such a big initiative. And it takes a lot of money and a lot of effort and persistence and perseverance. So I think that's been the biggest challenge, is setting a vision, recognizing this is going to take a while, and then staying the course. Along the way, we had a lot of technical challenges. When we started building this platform, blockchain was pretty immature. There was a lot more ideas than reality. There were too many, I would call outrageous use cases that had no reality, basis in reality or usability or legality. So we had to be patient, and we had to sift through what is doable now, what will be doable later. To put things in perspective, the biggest challenge has been to be able to predict where the technology is going and prepare for it, kind of the Wayne Gretzky example of skate to where the puck is going. And I'll give you a very specific example. Every single Care Wallet holder in our world has their own computer behind the wallet, right? And that's a Web3 compute container. Now, 5 years ago, nobody understood how we would ever implement a Web3 compute container, because we are all used to cloud computing, where we put all our logic in the hands of Amazon to run, or in the hands of a data center that I used to run. So the idea that every consumer, every human being on the planet can have their own virtual computers, which they don't see or touch, but that serve them and them only, which is the principle of Web3, didn't exist. So we knew that that's going to come one day, but we had to predict what kind of computes will eventually arrive, and we had to build to both the present technology and the future. But now Web3 compute is possible. It supports our Care nodes behind the wallet, and wallets are truly decentralized, where we have decentralized compute and decentralized storage behind every wallet, meaning you own your data, you own your computer where your wallet is connected to, and nobody can peek inside your data or your computer, and nobody can take it away from you. That kind of autonomy, it took a lot of patience and hard work to realize, but it's here. So I would say that the hardest thing has been to set a 10-year roadmap, which we did. Start walking down the path when others didn't believe you this is achievable. Even internally, people question whether we'll ever get there. But keeping everybody motivated and focused on it. And I think we are about 3 years ahead of curve now. We are achieving what we would call our dream scenario, which we thought would take 10 years. I think we're going to get there in about 7.5.
That is phenomenal. Congratulations on that. And again, like I see how, even though on the surface for like how you described it, it can look simple for a lot of people, but there's a lot of intricate details that go into making something like that so fundamentally sound to work in the practical reality and to be able to be flexible for the future. The follow-up question is, now that you've gotten to this point, we're here. What do you see? What do you anticipate coming in the road ahead for Solve.Care in terms of what it can offer people? And maybe, I guess at the same time, what challenges will you look to overcome using the Solve.Care in the road ahead?
So for us, the mission now is to focus on the top 10 killers, the diseases that will kill billions of people in the coming 2-3 decades, and to make that life journey a lot more efficient, effective, and less painful in terms of healthcare. So we have identified that we need to approach this problem in very simple sort of tracks. One track is focus on the diseases that affect most humanity. Those are the 8 to 10 diseases that we need to work with reputable healthcare organizations to deliver globally accessible best care practices and content for everyone. So whether you live in sub-Saharan Africa or you live in South America or you live in Southern California, everybody should have access to what is clearly well understood way to take care of yourself, but 99% of humanity doesn't know that. So make it a very easy to understandable, usable, accessible care models for every disease that we'll care about. Me, my parents, my kids, we should be able to go to one place and say, what do I do? Okay, that's one track. The second track is to get the enterprise to adopt it. People like me in my old role, CIOs, CTOs, COOs, who are looking for ways to run their business better, be it insurance company, be it a hospital, be it a pharmaceutical company or a pharmacy network, and show them that we are a much cheaper, much faster, much more secure platform where you don't have to go to bed every night thinking, am I going to have a HIPAA violation on my hands tomorrow because somebody stole some data from my data center? We eliminate all those crazy risks, and you can literally focus on the business of doing business. So enterprise adoption is our second goal. And the third goal is community adoption, which is to give every single innovator in healthcare, be it in here or be it in Bangladesh, doesn't matter, to be able to use our platform to build care networks which deliver value and revenue to them, and we get more utility. But we're trying to reduce the cost of authoring a card down to such a low level that your economic status or your economic constraints should not matter. You should be able to build and use cards in your community, at a extraordinarily low cost without sacrificing security and usability and compliance. So we want to make this fabric as close to universally accessible and make as much of it open source as we can so that a global community can trust and use the platform. So those are sort of three clear tracks: disease-centric enterprise adoption, and make it globally accessible for people to do things that we cannot even imagine. And I bring us back always to in the company to this legend, whether it's true or not, I don't know. But when Apple was launching App Store, there were some folks within Apple presumably arguing for Apple to be the author of apps, to build the apps. And their leader said, we are smart enough to build the App Store, but not smart enough to imagine every app the world's going to ever build. And look at billions of apps people have built since then, some wild, some crazy, some life-changing. There's no way Apple could have envisioned every single use case and try to control the App Store by being the app writers. And wisely, they focus on making the App Store universal, but then let the imagination of humanity drive the apps, right? And look at the new world we live in, where we don't I don't ever go to websites. I do everything from my phone by using some app or the other. So our vision is the same, that for healthcare, everything you want to do in healthcare should be just a set of cards on your wallet. It doesn't matter whether you're a service provider or a service consumer or a service payer or a service auditor or a service facilitator. Doesn't matter. Whatever needs to happen in healthcare can be just seen as a deck of cards, which are really smart apps you can build very quickly. If we take that premise forward, then we need to make everybody capable of either using the app or writing the app or both. So that's a community adoption. And I think those three approaches will give us the greatest impact. Even if we don't succeed on one track, the other two tracks will more than make up for it.
I love that. Perfectly answered everything that I was curious about. I love what you're doing here, and really, really transformative stuff. This is the things that get me passionate about blockchain, Web3.
Yep.
So I'm glad to know that you've stayed the course, that you found people that believe in what you're doing, and that you've gotten to this point thus far and looking to take it forward.
Thank you. We are excited as well. And we hope that many people in the audience will be inspired enough to pick up the phone and call us and say, look, I want to build something for my community or for my family or for my practice or for my hospital. And we'll be more than happy to show you how to do it yourself and support you if you need our help. But in the end, the goal is that you can do everything that you need to do without needing some big, IT firm coming and helping you out.